The period following discharge from the hospital is a vulnerable time for patients. About half of adults experience a medical error after hospital discharge, and 19 to 23% suffer an adverse event, most commonly an adverse drug event. Despite the comprehensive discharge plans with referrals designed to help support these activities and the activities of daily living, participants experience challenges with social support and referral uptake, resulting in a loss of stability which was achieved in the hospital. There is strong evidence that points to the longer the patient stays in the emergency department, the longer their inpatient hospital length of stay will be. For example, a prolonged emergency department stay for an older admitted patient is associated with an increased risk of an in-hospital adverse event. Research has shown that the discontinuity between hospitals and primary care physicians, changes to medication regimens, new self-care responsibilities that may stress available resources, and complex discharge instructions are detrimental factors that may cause a patient to quickly avoid a safe discharge. A few concepts that research shows to help in the discharge planning process are their approaches to promoting more effective transitioning of care. These include improvements in communication between inpatient and outpatient facilities, physicians, and staffing, effective and practical reconciliation of prescribed medications, adequate education of patients about what medications they are taking, why and when, engagement with social support systems, and a greater clarity in physician-patient communication. Hospitals and providers also significantly impact whether or not a patient is successful when they are discharged. Hospitalists and other inpatient providers should not view discharge as an end to their obligation to the patient, but rather should attempt to promote a safe and effective transition of care. Hospitals can play an essential role in bridging the gap between inpatient and outpatient care through appropriate discharge planning and effective communication with patients, family members, and outpatient physicians.